Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Today I'm joined by Patty Hayward, the Vice President of Strategy at Talkdesk. How are you today, Patty?
I'm great, Jared. How are you?
I'm doing well. I'm excited for us to chat today, and I think we should dive right into it for the audience. If you could tell them a little bit about your background, then we'll talk more about some of the topics we wanted to discuss here today.
Great. Yeah. Thanks for having me. So, a little bit about myself. I have spent the last 25 years in healthcare IT. I've worked in a lot of different areas, including pharmacy, working with EHRs, working with population health, analytics. I've spent some time both on the provider facing side as well as in a payer organization. I spent a couple of years over at Aetna working and helping them form ACOs when they were brand new to the market. So, been around quite a few different areas of healthcare, and really, for me, my passion has always been transforming healthcare and trying to make it better.
Thank you for that. Yeah, that's. I'm sure there was a lot of things that you learned over at Aetna that coming over to Talkdesk has really helped you in your current role, and um, so it's. I always like when I hear people. I think it's important for people if they have that opportunity to have experience with the payers. It allows you to kind of see both sides of the fence a little more, and I think it allows you to put yourself in the payer's shoes and kind of vice versa, so you're able to fully understand kind of how is everyone feeling about whatever the decision that you make is.
100%.
So what a lot of people don't know is when I was first starting my career, I worked for a company, Go Hire, that actually worked pretty closely with Talkdesk, not with your healthcare vertical, but so I was familiar with the company for a while I was working with them. And then this was before I think you fully kind of made the push. This was a couple years ago into healthcare. Can you talk us through Talkdesk's role in healthcare quickly before we kind of talk more?
Yeah, great. Well, as you know, we're a 10-year-old company that really has worked in all industries, right? Now, all across. But about a year and a half ago, there was a decision made to really look at healthcare and a couple of other verticals, but healthcare specifically, and realize that in order to really make an impact, we needed to hire some professionals that really understood what's going on in healthcare and what kind of things do we need to build in order to really make an impact there. So for us, it's really about that member experience and looking at how can we really affect and make that journey just easier and better for both the member as well as the organization itself. We all know the impacts, especially that COVID has had. This all sort of coincided at the same time as COVID and the pandemic happened, and there's nothing more important right now than healthcare access and our ability to get the information that we need. So I think being able to really be at that inflection point has been really both a challenge and a privilege to be able to get in and really help organizations review.
Absolutely. And I'm glad you mentioned the pandemic there for a little bit because the pandemic really accelerated a lot of the digital transformation that we're now seeing in healthcare. Um, it really for the good, right? If anything good came out of the pandemic, that was one of the pieces, um, perhaps one of the only pieces, right? But one of the very important pieces. It really moved us forward several years in the digital health transformation. Now, in regards to the relationship between payers, payers and their members, how has the pandemic though affected that relationship?
Yeah, that's a great question. I think that a couple of things. I think if you think about everybody sort of having to go home, right, and nobody really wanted to leave, so the adoption of digital technology became so important and really had to happen overnight for a lot of organizations, and being able to have that ability to interact in a truly digital way and having everybody sort of be able to be safe and still get the information they have that they need, et cetera, is really important. And I think that also as people started to really use digital technologies in other verticals, their expectations started to rise a lot more about healthcare, right? Thinking about what healthcare delivers typically hasn't been very digital. It's always been very voice, very in person, those sorts of things. So I think the expectations have shifted dramatically for that relationship, that there is more available, more readily accessible for them at whatever hour they would like to have, and really being able to get what they need at a moment's notice. We all sort of know that Amazon experience of 2 clicks and you've purchased. I think those expectations are really going across all verticals in healthcare, especially. And I think that, that's something that the payers have had to really think about. And I think also, looking at a lot of social determinants of health, that's really become a very big viewpoint because of the pandemic. It really shone a light on folks that got isolated. If you think about what's happening a lot with the Medicare Advantage space, a lot of these organizations really had to think differently because our seniors got very lonely. They weren't really able to go do anything. So they really had to think about different ways to engage. And they found themselves getting phone calls because they just wanted someone to talk to. And so just plain automation isn't really going to cut it either. So there was a lot of things, I think, that the dynamic has shifted a little bit in the expectations around what do we do to take care of our members and how that looks.
Absolutely. Yeah. And can you kind of, you talked a little bit about this, but specifically, like, can we talk about technology? And I guess actually specifically in regards to technology, how has AI helped solidify that member experience?
Yeah, that's a great question. So I think adding on to sort of that whole idea that um, AI is really important to help everything, but you can't just go into the bot experience, right? Because I think the other expectation that's changed is that, members really want to be seen. There's this, personalization, like you're supposed to help me and navigate my health system. Right. And so just sort of putting everything into a chatbot isn't really going to help. I think the aspect of AI with really empowering the agents and allowing them to give them answers, not articles, because we also had a lot of churn in that area. If you think about, agents that are answering the phone, there's a lot of churn in that organization, just like we've all experienced with the Great Resignation, and not like the call center was a someplace that didn't experience a lot of turnover anyway. So I think AI infused into a lot of different areas is important when you think about the AI in the knowledge base. We've always sort of pulled up articles that someone's supposed to read and a lot of information and digest and then give information out. We also usually tend to have lots of different repositories for the information. So an agent is having to go through a lot of different areas to get the information, digest it, then give the answer to the member. That's really difficult. It's also not a great experience for the member because they're usually waiting for long periods of time. They get inaccurate information, then they have to call back. So I think AI being infused throughout the knowledge management system is also really, really important, allowing answers, not articles, and really being able to bring that experience for both the agent and the member to a higher level is crucial. We all know that we have the AI infused with things like authentication, et cetera, but there's also some great AI out there that can detect emotion, right? Being able to understand when a member is upset, being able to say, and escalate or flag that there wasn't a good interaction. If you think about what CMS is doing and really putting a spotlight on member experience, plans really need to understand what's happening with that interaction. And if there is a bad experience, they need to be able to make sure they're doing something to resolve it. So I think there's a number of different areas that can really help. That isn't just sort of your typical thinking of like, I'm speaking to a robot.
Yeah, and I'm glad you answered this too, because that kind of was going to tie into, my next question regarding, what are some of the ways that their payers are starting to improve their customer service prowess? And you mentioned it, right? Obviously, that's where part of the AI answer went through. If there's anything else, because I didn't specifically like that you want to add to that, let me know. If not, you answered it great though with the
Yeah,
technology
I
question.
sort of blended that in there with that first one. But a couple things that we found when we actually did some studies where we, one of the things I think that's great about Talkdesk is really trying to understand what's going on. So we actually interviewed, 300 different members to understand, what is it that that makes a good experience, right? What is it that's not working for you? And the biggest thing that we saw was 84% of members who had a positive experience said a knowledgeable agent was key. So I think it goes back to that whole, how do we empower that experience around what we can do for the agent, that can really make a difference for whether it's a commercial plan, whether it's for Medicare Advantage, et cetera. I think that's really important, and the understanding of how that member is feeling as they're speaking to them is also super crucial, because it allows for the agent to provide a more empathetic experience. And I think one thing that's come out of this pandemic is we're definitely seeing people want to be seen. They want to, they want to be seen as a human. And, when they're calling, they're typically experiencing some event and they need help. And our healthcare system is not easy to navigate. So having a knowledgeable agent to help them through that is really, really important.
Well, Patty, I want to thank you once again for joining me on the Slice of Healthcare podcast. Really appreciate having you on here today. And hopefully, in the future, we can have you come back on again to kind of update us on where Talkdesk is at, and also go into some other issues within the space. But again, thank you so much for joining me today.
You're welcome. It was great to be here. Thanks, Jared.